Well, hello class, and welcome to my video on drugs for heart failure. Today we're going to be talking about digoxin and milrinone. So first of all, thinking about heart failure, it's really hard to describe how medications work unless you're understanding the pathophysiology behind them. So let's talk a little bit about heart failure and make sure you have a really good understanding of what that is before we move on to the drugs. So I always try and explain heart failure to students as to thinking about it like a traffic accident. So if you think of the blood and the vasculature in a body, it's very similar to a highway. The blood is like the cars, it delivers things back and forth through the highway system, the vasculature of where things are needed in the body. It brings oxygen and nutrients everywhere that it needs. Well, what happens if there is a problem in the heart, let's say? And let's compare that to a traffic accident. So if you have a problem in the heart or heart failure or a car failure, where are you going to notice that buildup of blood or that problem with the blood? You're going to see the problem like a traffic accident to where that blood has come from or where those cars were coming from. So it leads up to that accident. So if you are having a car accident or a problem with your heart is failing, you're going to notice a buildup of blood. And what is it going to look like in your patients? Well, it depends on where the heart failure is. So for purposes of your pharm exam, you don't need to know the specifics of this, but I want you to think of the pathophysiology behind it because it'll help you understand the medications. So if you have a problem with the left side of your heart, if the left side of the patient's heart is failing, think of where that blood has come from. So if you think of the blood flow of the heart, if it's having a problem on the left side, the blood has just come from where? The blood has come from the lungs, right? It gets oxygenated and then it goes to the left side of the heart and gets pumped out to the body. So if you're having left-sided heart failure, where are you going to notice a problem with your patient? You're going to notice it in the lungs. So the patient's going to have extra fluid, crackles, junky sounding lungs, trouble breathing, and so forth. And then the other side, if you have a heart problem on the right side, where does that blood come from? Right, it comes from the body. The body is delivering that deoxygenated blood, the blood that needs to get back to the heart. So it is coming from the areas of the body. So mainly the upper and the lower, but we'll notice that edema in the lower extremities or the legs. So you'll notice that puffy skin, pitting edema. So you want to look at those, both of those things when you're having a patient that has heart failure. So digoxin. Digoxin is a cardiac glycoside. And before you start thinking, well, if you've had clinical experiences now and there's not much digoxin being used anymore, that's true. A lot of the newer medications means that we don't have to use as much digoxin anymore. So less and less patients are on it. So a lot of times students will get done with the pharmacology class and say, we didn't learn about all the new drugs that are being used on the units. Well, that's because we don't teach all of the new medications that are out there, but we are teaching the good old tried and true medications that are still on NCLEX that you still need to understand. And once you understand how a drug is going to affect a patient that is being treated for heart failure, you will be able to understand all of the different medications with just those simple differences that they have between them. So remembering that digoxin is a cardiac glycoside. Well, how is it going to help a patient with heart failure? Well, number one, it's going to help with contractility or how that heart squeezes, right? The heart is a muscle and the muscle cells in the heart squeeze and they get that blood to get out and delivered into the body. So it's going to increase the strength. It's going to increase that contractility so it'll be more efficient. It also will slow the conduction through the heart. So you're going to notice a slower heart rate. So with both of these things, the slower conduction and the harder squeeze, you will notice that the heart is able to pump the blood more efficiently through the body. Now, one thing you really need to be aware of and understand is, what is the interaction between potassium and digoxin? Well, first of all, the way that digoxin works is in that sodium potassium ATPase pump. So the digoxin um, fights with potassium to each hook onto that ATPase pump. So if you have a lower amount of potassium, then digoxin is going to be able to be increased. It's going to increase that level. It's going to be able to be used more. So you're going to notice, if you have a lower potassium, you're going to potentially notice a higher level of digoxin within the body. So you really want to be careful about that. So understanding what the symptoms of digoxin toxicity are definitely an important part of digoxin therapy. Okay, so you're administering a patient digoxin. What are some things that you need to watch for? Well, number one, we are giving it for the heart, so absolutely you're going to need to monitor that patient's heart rate, their rhythm, their blood pressure, how their circulation is working, checking their pulses, and so forth. Next, you want to look again at the patient's symptoms of heart failure. Are they having edema? Are they having problems within their lungs? Urine output, because the heart is being able to be working more efficiently, it should be able to put out more urine. And again, watching out for that potassium level, because if you have a lower potassium, you may notice digoxin toxicity. Also, think about the different medications that the patients are on as well, and how that could be affecting all of what we've discussed. So let's do a case study. So an elderly patient is started on oral digoxin for heart failure. Which of the following will be relevant information? So I gave you some excerpts from the patient's chart, and I want you to take a minute. You can pause the video and go through and think about which of those data points would be relevant for this patient. Okay, so did you pause the video and come back? I hope so. So number one, that heart rate is 62. What kind of heart rate are you looking for when you are administering digoxin to a patient? Well, you know that it's going to slow the heart rate down. So where do you want that heart rate to be when you're administering it? You want it to be above 60. If that patient's heart rate goes lower than 60, you are going to hold that digoxin and notify the provider. If that heart rate is 62, that's absolutely fine. You need to administer that medication, because remember, this is going to help the heart continue to have that nice, slow, steady, and squeezing the heart appropriately. The blood pressure's fine, the respiratory rate's fine. Moving on, then their sodium level. I did put the normal values in the parentheses, so you don't have to memorize those at this point for this class, but later on you will need to memorize some of these lab values. The potassium is a level of 3, and a normal level for potassium is 3.5 to 5. So is that concerning to you? Why? Exactly. If you have a lower potassium, more digoxin is going to be able to work inside the body. So you're going to notice that higher level potentially of digoxin. So you're going to worry about digoxin toxicity. The white blood cells are fine and not affected in digoxin therapy. The urine output is 50 milliliters per hour. Normal is 30 milliliters per hour. You always want to be monitoring your patient's urinary output when they are on digoxin. It will potentially make increased urine output because it is removing some of that extra fluid. It's making the heart more effective. The lungs have crackles in them. So yes, you wanted to be monitoring this because hopefully it'll be, again, clearing that extra fluid out of the body and making the heart pump more efficiently. And then the lower extremities, the patient has edema. You want to be monitoring that. If you don't know where they started, you're not going to know if the medication is improving their heart failure or not. And they're also on a medication called furosemide. Is this significant? Yes, absolutely. Why is that significant? Well, furosemide is a loop diuretic that is potassium wasting. So we need to already monitor that patient who's on furosemide for a lower potassium level because they're excreting potassium. So if you have a patient who is on furosemide and digoxin, they are more at risk for digoxin toxicity. Great job. So your patient continues on this medication, and now you are monitoring the digoxin level, and you're noticing it creeping up, and now you're noticing that the patient is maybe having some signs of digoxin toxicity. What would that be? Headache, nausea, vision changes. They may have this yellow halo around things. So a lot of GI effects. You really want to pay very close attention because it can be very dangerous to have a patient with digoxin toxicity. If the patient does have digoxin toxicity, you can administer the antidote to that, which is digoxin immune fab. Moving on to MILRINONE. Now, MILRINONE works in a similar way in that it does help patients with heart failure, but this is usually administered to patients who have life-threatening heart failure. It's administered for a short period of time. It is called a phosphodiesterase inhibitor. And so what it's doing, it's also increasing that contractility of the heart, acting as a vasodilator, so you may notice a decrease in blood pressure. So you really want to make sure that you are monitoring the patient's blood pressure and their heart rhythm. And that is it. Hopefully this helps your understanding of drugs for heart failure. Take care. Bye-bye.